Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with the joint faculty appointment at Ross University School of Medicine. I wanted to go to the Mayo Clinic website and present on something that actually affects a lot of people, especially when they're in a hospital. And so this is something that has been investigated previously about how it occurs. So for starters, Clostridium difficile. Clostridium difficile causes the inflammation within the colon, and that causes the inflammation and overgrowth of the bacteria, C. diff. And the symptoms of that are pretty straightforward: watery diarrhea, and these lead to toxic megacolon sometimes, but abdominal cramps, pain or tenderness, fever, pus or mucus in your stool, nausea, and dehydration. And this is dehydration to the point that you're feeling sick. So, with that pseudomembranous colitis, it's 2 days after you start taking an antibiotic that you'll start to feel that. The sad thing is that this a lot of times can go on in several months or longer. What are some of the causes? Well, of course, C. difficile, which are usually present in only tiny amounts. So it's actually a biofilm created from multiple bacteria, and they rise to high enough to damage the colon. So Cipro, penicillin, Cleocin, and cephalosporins. Thank you for listening. Now, I wanted to talk about the complications that can be caused by a pseudomembranous colitis. One is, of course, I told you about dehydration, but kidney failure sometimes can be an outcome of dehydration, which can be taking place very rapidly. Now, toxic megacolon, that is an important rare condition that you have to be aware of because there might be excess gas and stool causing it to become greatly distended, megacolon. When you see this, this is an emergency because this enlarged or ruptured colon requires emergency surgery and may be fatal. So that's something to talk about and think about. A hole in your large intestine, bowel perforation. It's a rare and results from extensive damage to the lining of your large intestine or after toxic megacolon. And you don't want bowel perforation because what it will do is the intestine bacteria will go outside and actually disrupt the peritoneum. And so the peritoneum is very important within the abdominal cavity, and the purpose of it is to kind of create a local sort of area so that it doesn't go and affect other places. But the peritoneum usually have a pain all across the abdomen. And then, unfortunately, mild to moderate C. difficile eventually can result as an outcome for death. But there's a lot of prevention mechanisms. Definitely hand washing is important. Contact precautions, thorough cleaning, avoid necessary use of antibiotics. So this is all the related pseudomembranous colitis, symptoms and causes, diagnosis and treatment, doctors and departments. So this is all there is in the Mayo Clinic about this. If you want more information, you can find it elsewhere. Thank you for listening.